Hey guys, welcome to CPD Junkie podcast, where we bring you interviews with the dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Laurence Doan, and tonight we are joined by Dr. Michelle Chen. Michelle graduated from the University of Queensland in 2019. She currently works as a general dentist in private practice in Ipswich, Queensland. She loves being a general dentist as she enjoys the variety it provides. Michelle has a special interest in oral surgery and aesthetic dentistry and hopes to further her skills in those areas through CPD, mentorship, and from senior dentists. Although she is a very recent graduate, Michelle has stepped up to help coordinate the graduate mentor program at her workplace. She is always up for a friendly chat and hopes to be able to help the graduates transition smoothly into the workplace and hopes to give them the positive experience that she's had going from university to private practice. Dr. Michelle Chen, welcome to the show.
Hi, Laurence. Thanks for having me.
That's all good. So you have a growing interest in oral surgery and aesthetic dentistry. Tell us how your CPD or dental journey into it all started.
So I'm very fortunate in that my first job after graduation already had a graduate mentoring program. So it gave me exposure to and allowed me to attend numerous courses that were beneficial to developing my skills as a graduate. Those courses included, for example, like a CEREC CPD, which opened my eyes to the world of CAD/CAM technology, something that we learned about at uni but had limited access to. There was also numerous communication courses like the one by Dr. Mark Assad, and one of the other dentists in our practice also did one of his own ones. His name is Dr. Elwin, and that was really good as well. I am fortunate enough to work with Dr. Sahil Soni, so he offered us some of his courses like the Anterior Composite, the Posterior Composite, his wax-up courses, his photography course, and his rubber dam workshop as well. And I think after doing that, that really gave me a good insight into things and gave me like a good set of like foundational skills. Having him within our practice, it was really good because whenever you'd have any cases that involved like composites or aesthetic stuff, we'd be able to bring our photos or x-rays to him and we'd be able to get really good advice, and just having that like support there gave me more confidence to be able to tackle it on myself, and having his support there. Also seeing his work, it was a great inspiration to me, and that kind of got me into taking on more aesthetic courses, aesthetic cases gradually. In terms of like oral surgery, when I started, I was lucky enough to be working 3 out of my 4 days with this dentist who does a lot of wisdom teeth. And at the time of graduation, wisdom teeth was something that I was really wanting to get into. So I used to block, I used to stalk her books, and I used to block myself off and assist her and watch her and like learn like that. And then gradually over time, I've been able to pick up some cases of my own, and she's been able to help guide me through it. So that's kind of where my interest started in that area there. Yeah.
Yeah, okay. So let's talk about it. So was there particular reasons why you were picking CEREC or communication courses, or, you know, Sahil's courses? Was that particularly because of the way the practice had structured the program, or was that something that you wanted to get into more specifically?
No, so it was already like a program that our boss had put into place for the graduates. You may know my boss, Dr. Navneil Kashyap. He's big online, and yeah, he's been hiring graduates for a numerous number of years, and I think over the years just gotten to know, I guess, which courses would be good for graduates to do at the very start of their career to give them good foundations. So it was all part of like a program. So yeah, I'm very fortunate to have been a part of it, basically. Yeah.
Right. And then the oral surgery side of things was mainly through the mentoring as well.
Yeah.
Yeah.
Yeah, oral surgery was just, I guess, by pure luck, but also because I had the interest there to start with, I would be a bit more nosy and try and assist whenever I can.
Well, I think it's important because, like, I think, one, you got to put out your interest to the people so they know that you're interested, for one. And then two is you got to follow that up. You got to follow that up by actually being showing that you're attending. When you say you're gonna sneak it in there, it's kind of okay. You're not trying to hide anything.
No.
You're open about it, and people know that you have an interest. So that's what you got to do, right?
Yeah, for sure. I feel like if you don't put yourself out there, then no one will know.
Exactly. So you went through this course, this program. How'd you find it? Was it what it was as you expected? Did you get as much out of it as you would have liked?
Yeah, so I think I got a lot more out of it than I would have liked. And speaking of which, after going through it last year, which was my first year out, this year I've been lucky enough to help coordinate the graduate program for the grads from like this new batch of grads. And I guess by doing so, I've been able to attend all these courses all over again for the second time because I have to be there. And I definitely found that the second time round, I picked up things that I didn't pick up the first time, and it helped to like reinforce things I was unclear about or things that I've missed out on. And I felt like my learning curve has really even gotten higher like this year compared to last year. So it's been really good. Yeah.
I think that's an interesting point. Not a lot of graduates talk about, and we actually had a previous guest on, Dr. Grace Cooper, who actually mentioned she's attending an aesthetic anterior composite course again for the second time, and you've just mentioned it there. You're attending it for a second time. You feel like you've got a lot more out of it. Do you think that's because of, as I've put it out before, is that to get the most out of something, you have to have some prior knowledge of it. That whether it be having learnt something a little bit beforehand, but also maybe having applied it in practice and then relearning it, it kind of consolidates all that information. Do you feel that's kind of the case?
I think consolidate is probably a very, very good word for how to sum this up, basically. Second time around, it definitely consolidated any misunderstandings or things that I wasn't very familiar with the first time around. And it's like sometimes you get that like aha moment where you're just like, oh, like how did I not know this beforehand? And then once you see it, you just can't unsee it. And then I feel like that's where you like really step up and you really improve. Yeah.
Yeah, that's fair enough. So, you talked about this graduate program that you went through it the first time and now you're helping out with it this time. Is there any particular changes that you felt that you wanted to change about it, that you wanted to implement in this program this time around?
Not particularly. I felt like it was pretty comprehensive in like covering the foundations for everything. And
I'll put it to you like this. Yeah. It's kind of like some people want to know if there's a particular way to structure how they should attend their CPD. You mentioned, you did CERIC first, you did communication after, and then you did the anteriors, and then after that, onto the oral surgery side of things. Was there any particular changes to how you approached or you wanted to change the program this time around?
So I think this time around is actually really, really similar to last time. I remember last time we did our CERIC course at the very start when we first started working. And then soon after that, we did our communication course. And during the communication course, they were explaining how best to sell crowns as like a treatment option to our patients is something that they need. And then I think because they were so close to each other, I had like the knowledge fresh in my head. So then off I go. I try to like apply this knowledge that I've gained at this communication course, and I try to like to get my patients to take on crowns as treatment options. And then we were able to like link it in that way. And I felt that really was really helpful, especially because I really didn't do any crowns during uni. I think I did like one, maybe and a half. Supervisor did the other half of the second one. So it was just something that I was really nervous about. But I think by improving my communication and getting more crowns to do over time, I was able to improve and get quicker and get more efficient in that area there. So I think the combination was really good. Yeah.
Yeah, and then you moved on to the anterior side of things. You know, you've gone through that a few times again. Some people say, you know, bread and butter dentistry, that's pretty basic. You know, why do I have to attend that twice? But you've attended that twice now. So what do you think?
The anterior composite course, I remember the first time I attended, I was the week before, I had tried to do like a filling on a front tooth myself. It was just like a broken, chipped front tooth, and I did it, and I just wasn't happy with it, and I struggled a lot with it. And then I remember going to this course, and Dr. Sahil made it look so easy, and I was just like, how is he doing this? It's so effortless. And then after doing his course, I felt like really eager and motivated to try and do like a set of anterior composite veneers myself. So yeah, I used my newfound communication skills to convince this patient that we'll try some like anterior fillings, because it was within her budget, I guess. And then I did it, but I remember when I was doing it, the whole time I was thinking, how does he do this day in, day out? This is so tiring. Like, things aren't symmetrical. Like, it just doesn't look natural. Like, it was a big struggle. And after doing that the first time, I was like, I never want to do it again because it was really stressful. And I found that when things aren't like symmetrical, it stresses me out because I can't figure it out. But then, so I left it for a little while, and then I did this course again. And this second time round, I was practicing how to use like the clear strips and the simple instruments like the sickle probe and just polishing discs to create like natural anatomy. And I don't know why, but the second time around, I found it so much easier. And I don't know if it's like some residual knowledge over the months of working that I've picked up on subconsciously that have added to it. But yeah, as you said, it really like brings everything together and consolidated my knowledge the second time round. And then sure enough, by chance, a week later, I got the chance to do some composites on a patient, like this, I think it was like a 3-3, and I was really, really happy with it. And it was just so much more smooth sailing the second time round. So
you think it might have been a bit of that pressure that you put on yourself, or it's that you knew or you kind of felt like you knew what you were doing? Because I feel like a lot of dentists are all about that millimeter different, that symmetry, you know, and sometimes we're just being a bit too hard on ourselves, and it's a matter of, okay, you didn't quite get it, but, you know, just give yourself a bit of a break and then recoup back and then practice it again. And that really is with the new fresh eyes, and then looking at working on that, you might be able to improve. So you've mentioned, you've just recently done those really sets of composites. You've actually been doing these gradual progression through full mouth rehab cases, wax ups as well. Talk to us about, did you do anything to get into that? Because not a lot of people will go back into do wax ups themselves. Not a lot of people do that to prepare them for the porcelain veneers or crowns, but you do.
So I've only done it for a handful of cases, mostly because Dr. Sahil's wax up course was one of the courses offered to us in the mentoring program. So after doing that, whenever I do a CPD, I have all this like fresh knowledge that I really want to try and put into practice before I forget it. So then I get really excited, and then I'm like trying to pick up cases linked to what I learned so that I can implement it in practice. So after doing Dr. Sahil's wax up course, I did find myself some cases and I would, take the impressions, and then I would take it to him, and then I'd be like, this is what I want to do. What do you think? And then he'd be like, yeah, let's do a wax up. So then he lets me borrow his wax up machine, and then we'd work on a wax up together. I do try my best with my wax ups, but they're not that good. And then most of the time, Dr. Sahil has to, refine it for me a little bit, or maybe a lot. But I think through him, I've really learned a lot in terms of that aspect of things and the treatment planning side of things. I don't.
You mean like how you look at it and how you kind of like, Mike, when you say treatment planning, you mean like how the steps wise, it might not be an overnight thing. It might be like, oh, we need to break this up into parts. Maybe do the lowers first, or maybe do anteriors and then work towards the posteriors. You mean like that?
Yeah, like that, like just general, like start to finish type of thing. And also like the small details kind of thing on the wax ups itself. He would point out things that sometimes I'd be happy with the wax up, and then I show him and be like, leave it on the bench, and then he gives it back to me. It looks completely different. I'm like, oh, okay, I tried.
Yeah. But yeah. I think I like the fact that you talk about how after you learnt it, you immediately want to go back and practice it. Because you didn't want to lose that knowledge and that and let it fade away, because that happens a lot of the times, isn't it? Because you probably talk to your peers and they talk about how they attend the CPD and they're just waiting for that case to kind of come along, and then
like the
by the time they wait, it's like 6 months later and you're like completely forgotten. It's not as fresh.
Yeah. I think I've been very lucky, but also I think you just have to be perceptive and aware to see where the opportunity is as well. Like sometimes it could be a little bit hidden, but then, if you talk to a patient enough, then you kind of find that it's something that they kind of want to do, but just no one's ever offered it to them. And then what's the harm in asking? Like that's the worst you get is no, basically.
Yeah. So let's switch to your oral surgery side of things. You've mentioned that, the first few cases in the past, you only do maybe single ones. You were nervous about those first few ones. And now you do like all 4 wisdom teeth in the one session. And that's kind of like, a good kind of progression. Talk to us about that journey.
Yeah, so last year when I first started, I used to stalk senior dentists' books and block myself off and assist them. And then after assisting maybe like 5 to 10, I built up the confidence to do like single ones myself. Upper wisdom teeth were fine, honestly, except for the unerupted ones, which I was always scared of until this year when I did my first one, and then I was like, oh, that's not too bad. But yeah, lower ones, definitely, especially the impacted ones, were more of like a mental challenge, and obviously they're a lot harder as well. So yeah, I would basically have like a criteria for I guess how difficult an extraction would be. After talking to my senior mentors, we basically go for a patient under 25, preferably under 30, conical roots, and because they're young, their bone would be soft as well. And I think my first surgical one was actually basically fully erupted one, where I could just practice the flap and the gutter and get comfortable with that. And then gradually I've picked up cases with, more and more impaction, like mesioangular impaction, distoangular impaction. But I try to stick within like the younger age group, because you never know when the bone can be so dense and you're just like, oh no, it's just stuck, right? Sometimes even if a section is bad, or if your gutter isn't as much as it should be, if the patient is young, their bone is so soft and forgiving, then the tooth will still come out regardless, kind of thing. And yeah, I would start with single side, and then I think gradually, as I've just built up my confidence, I've been able to get patients to do all 4. Although I don't do them as much as I would like to, but it's something that I hope that I can do more in the future, because it is something that I really enjoy, even the ones that I struggle with, and I come out with like sweat on my back, but then it still leaves me wanting to do more.
Yeah.
Yeah.
So of all those CPDs, has there been one or a few that's been the biggest clinical impact on your dentistry today?
Oh gosh, I don't think I can pick one because they're so interlinked. But from the top of my head, the ones with the greatest immediate impact would definitely be the communication one, because obviously I don't think we were really taught a lot of communication in university, because one, everything is free. I think mainly because everything was free and patients had just taken what they were given. And then the CEREC one was also very, very helpful. And now I do a lot of CEREC crowns. The photography course actually really taught me that, you know, a picture can speak 1,000 words. And obviously the Anterior Composite course one as well. Be able to deliver, you know, anterior fillings that I'm happy with is really, really important. And because anterior fillings are so like vital to someone's smile, it's like one of those things where if the patient sees it, they're like, wow. And then that's kind of when they like start coming back to you as well, or they like tell their friends and family about you. So that makes a big difference as well. Yeah.
Yeah, I think you make an interesting point there. You know, when we're at uni, we probably got taught a little bit about communication, but we probably weren't at that point where we were kind of interested in it or soaking it up as much as we could. Because I've talked about it in the previous episode about a professor that I used to have back at uni as well, and she was teaching these things, but at that time we probably just weren't taking it up, and now we're taking it up and we see it more applicable now.
Yeah.
So have there been any CPDs that you feel that you didn't implement or was not as beneficial for you at the time, and would you do it differently next time?
Yeah, so I recently attended like a clear aligners CPD because it's something that I want to get into, but I found it not as beneficial because I'm being a complete newbie to clear aligners. I realized when I was there that everyone else had already done some cases before. So I felt like the course itself was catered more towards dentists who had some experience in the field already, and that they could relate to things that the person who was taking the course was talking about, and they had their own cases that they could take the knowledge and apply to. Although I did try my best to absorb and digest the things that were discussed, in retrospect, probably would have gained a lot more if, I was more familiar with the computer software that they use and had some of my own cases that I could apply the knowledge directly to, instead of just like having it in theory and just writing down a bunch of notes from it. So yeah, it might be something that I might go back and attend once I do start pick up a course, like I did for all my other things the second time round. Seems to work a gem. Yeah.
Yeah, okay, that's interesting. I know that in the past that some of your boyfriends attended some of your courses.
My boyfriend?
Is that right?
Oh, so he actually works with us. So he comes and joins like the graduate mentoring program as well when we have the courses on. So yeah, he works in our group as well. So very lucky to be able to work together.
What's it like when it's been put on you, when you're the patient in the chair and you're being rubber dammed up with all the flosses and everything?
So my boyfriend is actually very, very gentle. And I try to be gentle, but I think I'm not as gentle. So I think he's the one suffering when we have to swap. Usually I'm fine. I'm just sitting there yeah, cool. And then I'd be trying to rubber dam on him. And then I think this was back last year when Dr. Sahil taught us about floss ligature. And I was doing it on his, it was like an incisor or something. It was a lateral incisor. And he was just like, ow. And then I was like, oh, I didn't realize how much it would hurt. He's like, yeah, I'm not numb. But no, he's a lot more gentle than I am. So I think, yeah, I'm the lucky one here.
So you've mentioned Sahil has been a great mentor for you. Have there been anyone else who's been a big mentor, or idol, or inspiration in your career, and why?
Oh gosh, honestly, so many dentists inspire me in their own ways. And besides Dr. Sahil being the obvious one, there is another dentist whose presence has made a significant impact on my life. She doesn't actually know this because I've never said it to her face, but her name is Dr. Sarini, and she was the one that I was talking to you about, who was really, really good at wisdom teeth. So I was lucky enough to work with her 3 out of 4 days a week when I started. And I remember during my first week last year, I saw a 5-year-old boy who just would not cooperate in the chair. He was screaming and crying, and I didn't know what to do because during uni I had barely seen any kids, And whenever a kid would cry, the supervisor would just come and take over. So like you kind of never really got to manage in that kind of situation. I just felt like really helpless. So I asked Larini for help, and she comes in and she starts talking to this boy. And I remember I was literally in awe at the way she spoke. She was so gentle and calming, but still like playful at the same time. And sure enough, the boy calms down and like cooperates. And then from that day, I made it my goal to be able to communicate with kids like she does. And aside from kids, she's obviously a garden at wisdom teeth, and she is kind enough to talk me through her surgical approaches before a procedure, like if I'm going to assist her. And she also stops mid-procedure to like explain things to me and show me things, which is like really lovely of her because it's so out of her way. Then when I started to pick up some of my own cases, she would help me, do a surgical plan for them and talk me through it. And she'd always go out of her way to be on standby for me in case I got stuck or I needed help. So yeah, I'm really, really appreciative of her. And I think I literally told one of my colleagues that I can't believe someone like her exists and that she's my inspiration. So one day I'd like to reach her level, both in terms of, her hand skills and like patient communication as well. Yeah.
Awesome.
Yeah.
That's kind of a good lead up to what I'm going to ask you next, which is, have there been any struggles in your CPD or dental journey so far, that our viewers might not know about?
So there's definitely been struggles. Social media is a highlight reel, and although I don't share a lot of cases, the ones that I do choose to share are obviously ones that I'm pretty happy with and confident enough to share in a public space. Although I would like to be, I'm not brave enough to share my failures with the public yet. Over the last year, there have been times where I have overestimated my abilities, maybe gotten a bit too confident after like successions of successes, or misjudged an x-ray, or underestimated just how difficult or sometimes even just how time consuming a procedure would be. And in effect, it would not only stress myself out, but also my assistant and the auxiliary staff. I think as someone with like a growth mindset who's trying to like make the most of every day, there is a very fine line in balancing trying to push myself every day, but also making sure there's enough time to get things done properly without stressing myself or other people out. I think I'm still trying to figure it out myself, but I think I'm getting better at it. There's been times where I started taking out a wisdom tooth and I think it would be okay, and then I start running late, and then I'm like, oh, maybe I'm almost there, and then it gets too late and I'm like, no, I can't do it. So then I have to like close it up and refer it. But I think that's where like patient communication comes in. Like as long as they're warned beforehand that it's a hard procedure, and that there is a possibility that they might need to be referred, they're usually really understanding as well. If I was to think of a specific example, something that pops into my head would be at the start of the year, I saw a patient who had a broken tooth. It was a heavily restored lower molar, a big amalgam filling. The cusp had broken off. And when she presented, she wasn't in pain. It was just broken and cracked. And I took a photo and I explained to her that we need to put a crown on this tooth if we want to strengthen it and try and preserve it long term. And she sees the photo and she's like, yeah, let's do that. And so we go ahead and I remove that big metal filling, and then I see along the base of the tooth, there's this fine crack line underneath what the filling was. So I took another photo and I sit her up and I'm like, you can see on the photo, there's this crack running along the base of the tooth. We'll go ahead and crown it, but I don't know how deep this crack runs. I don't have x-ray vision. You're not in pain right now. So if you are happy to go ahead, we will go ahead and crown it. And hopefully the crown will hold the whole tooth together and prevent it from cracking any further. And you'll be able to keep this tooth. And she's like, yeah, let's do it. So we go ahead and we finish the crown and she goes off and I don't hear from her. And then like a couple months down the line, I'm at home on my day off and I receive a message from my colleague who saw her for a toothache. And then he's like, yeah, you did this crown on her and she has a vertical root fracture, and what would you like me to do? And then I'm like going into panic mode. So I'm like, oh, just book her back in with me tomorrow and I'll speak to her. And that night I could like barely sleep. I was stressing. I was like, she's going to be mad at me, or she's going to be angry at me for, you know, convincing her to spend this money trying to save this tooth. And now she's probably going to lose this tooth. And I go into work the next day, and I think she was my first patient of the day, which is good. And then to my surprise, she comes in and she's like, oh, you were right. That crack on the bottom, it's as you predicted. It was bigger than it seemed. She's like, and yeah, this tooth needs to come out. But she was like really, really appreciative of the fact that I tried to save the tooth and gave the tooth a chance. But yeah, I didn't charge her for the extraction, but we took it out and now she's getting an implant there. But I think at that moment, it really highlighted to me like the importance of communication and even the importance of photography. Like if she hadn't seen that photo of the crack on the base of that tooth, she probably wouldn't have, you know, had that image in her mind and be able to accept this as easily as well. But yeah.
Yeah, I think you've just pointed it out. You know, when I was listening to you talk about it, that's so important. You know, when I look back at my years as well, that communication, if you can communicate everything as much as you can, all the things that you kind of foresee or not foresee, if you lay it out to them, it's actually better for you. Because if you don't mention it and you kind of hide it and you want to show that, you know, actually in the mindset you're thinking this could happen, but if you don't say it and they don't know, then when it actually happens, then you're stuck in a rut. It's all about that preventing rather than trying to cure the issue. And, you know, if you communicate it, then they're obviously on a better mindset as well. And the other point about that photo, I think 100% agree with you. Sometimes, you know, a lot of what we used to do was built on trust back in the day because you couldn't take photos to kind of show it. But now in the modern age, you can take these photos. And like everyone says, a picture says 1,000 words. And once you kind of show it to them and they understand it, you know, you're on the same page. And if they don't understand it, well, at least you kind of know that you're not on the same page and you feel comfortable to maybe not proceed or whatnot, depending on that situation. So I think those are some pretty good points that you've pointed out that I think everyone that goes through their first few years definitely experiences.
Yeah. And as you said, you know, if something bad happens or something doesn't go to plan and then you try and tell them afterwards, then it just seems like an excuse, rather than if you tell them beforehand, then they're like, oh my God, you're a genius. You like predicted it kind of thing. It's as you said, like, but thank you for trying. So it's always good to tell them beforehand. Yeah.
So, you know, during this period of time, there's lots of graduates right now that are very nervous. You know, when it comes to the lead up to the interview. I've heard that, you know, you've actually been a little bit nervous in the past in your lead up into your interview. You know, you're worried about fitting into the workplace, you know, your lack of experience, your competency level, you know, getting stuck. How do you kind of debate all these kind of things? Talk to us about, you know, now that you're gone through that stage, what graduates might need to think about in the lead up to it.
Oh gosh. I think I still remember how nervous I was before my interview to get the job that I'm in right now. I think during uni, I wasn't particularly outspoken or anything like that. I felt like I was just like average, middle of the pack kind of person. So I think I had my own doubts in, you know, whether or not I'd be employable, I guess. But yeah, after getting the job offer and accepting the job, I've like never looked back. Prior to starting work, the whole week I was really, really nervous. Even on the drive to work, I was nervous about whether or not I'd fit in, whether or not people would like me. As you know, most people do when they start a new job or go to a new place. You are nervous because everyone wants to be liked and everyone wants to be accepted. But yeah, literally within a week, not even a week, maybe a couple of days of working, I felt very comfortable in the environment that I was working in. I felt that I was being supported and people respected, or they understood that I was a graduate, so they would give me more time to do things. I wouldn't have any pressures, and senior dentists and staff were so happy to help me whenever I asked questions or needed help. So yeah, if for any graduates looking for jobs, I would definitely try to look for a place that does understand the needs of a graduate, offer that mentorship. If they know anyone who has worked there, maybe ask them for their experiences. I guess testimonies always help. Like if someone else has had a good experience there, then you know that you have one foot in the right place. I guess don't focus on money. Definitely focus on getting good mentorship and being in a place that would support you and give you a good foundation to begin with. Yeah.
Yeah. So you graduated in a year where there was COVID, there was lockdowns, So how do you feel that affected you? And what would you say to recent graduates now? In terms of their learning, their growth.
So I graduated in 2019, and then I started work at the start of 2020 for and COVID came, and then it was lockdown for 2 months. So during that time, I guess we were stuck at home, but and obviously being new, we weren't really needed at work because we didn't have a patient base, and we were only seeing emergencies anyway. We just tried to make the most of that time at home. Obviously, now when everything's online, there's so many courses you can do, so many ways that you can try and improve on yourself. So you just try and make the most of the time that you have in the place that you have, I guess. So if you can't be at work, or if you can't get the hands-on experience, definitely, listening to podcasts. I remember back then I started listening to every episode of the Dental Head Start podcast, which started, and now there's so many podcasts, but back then I think that was one of the only ones. So I listened to every single episode of that. And then there was CPDs available on ADA, and other things like that. And my boyfriend had some textbooks that we're going through as well. So I guess you just try to do what you can in given situation that you can, and then it's all cumulative. So if you had that knowledge in your brain and one day you're in clinic and you need to access it, I guess it's just there for you. I think I was still lucky though, because I didn't graduate in the year that was heavily affected by COVID, which is last year. So I guess I can't really relate in terms of that aspect, but still affected a little bit. Yeah.
Yeah. Well, I mean, look, we were all being affected by COVID at a particular point. But for you, when you're so early in it, and for a lot of people, they were slowly booking up all those CPDs that they were going to pick, and then it obviously affected a lot of people. Graduates now are probably coming out and they're like, oh, it's going to affect me again. How do I kind of champion through it? But like you've just said, you would attend online courses, ADA's CPD portal online has been a great access for you. And at times, textbooks even is where you've looked to kind of still feel like you're growing and still learning, even when there might not be physical hands-on course that you can attend at the time. Yeah. So what does your current ideal clinical day look like, and the type of procedures you might be getting up to?
My current day? Well, my current day consists of a good mix of different procedures. I guess just ranging from checkups and cleans, emergencies, fillings, crowns, pediatric dentistry, some wisdom teeth, and a little bit of endo here and there. Honestly speaking, I'm not sure what my ideal day would be, because I really enjoy the variety I have going on right now. I'm the type of person that gets bored with repetition, so having a mix of procedures, it keeps me on my feet and it keeps my brain engaged. So I'm pretty happy with what I'm doing right now, but moving forwards into the future, I think I would like there to be more oral surgery and more aesthetic work to come into it as well.
And what kind of courses do you want to kind of take on to kind of get you to that point?
So in terms of the oral surgery side of things, I do find that very interesting. So I'm thinking maybe I will take on start doing some implant CPDs as well. We have a dentist who works with us who places a lot of implants, and he's nice enough to let us restore the ones that we refer to him. So I've been able to do like a couple implant restorations under his watch, which were stressful but also fun. But yeah, in the future, maybe looking at getting into implants as well. But definitely getting more confident with like wisdom teeth first before I get into implants. Yeah.
So outside of dentistry, you run an online food blog, called at Run to Food, and you started that as a hobby during your university years, and has gradually turned into more of a little side hustle. What do you think for a lot of the plethora of graduates now who are coming out with these social media accounts, and how should they think about it?
How should they think about it? Well, I think of mine as still being a hobby. It's like a good balance and a good creative outlet, essentially, to what I do for work. It's so drastically different. It's engages a completely different side of my brain, which is great, because, if I'm burnt out from work or tired from dentistry, I don't have to go home and do more dentistry. I come home and I'm like, what should I bake? But I know a lot of graduates are making like social media accounts for like their dental work, I suppose, which is great, and putting themselves out there, which is awesome. But I guess just my advice would be try not to take it too seriously. I think when you make something into like work or like a job, then sometimes you enjoy it a lot less. But because I had this going as like a hobby the whole time while I was studying, it was something that I would like look forward to doing, kind of thing. I look forward to going home baking, and when I started sharing some of my recipes with my followers, I received so much like positive feedback, and it was like a loop, and it like got me addicted, kind of thing. And I would like try and like in effect share more with them, and then over time that cycle has just helped my account grow. And then I guess one day people just wanted to pay me for what I do, which is great, because if you spend so much time and effort into to do something, it always feels good to be reimbursed for your efforts.
I think an interesting point you just made is the fact that you shouldn't just create an account just because you want to catch onto this wave. It's more about you're doing it because you actually have a passion for it, because otherwise it's not really going to go the long mile. Like you said, you're just going to treat it like work, and it's just going to drain you. Yeah. But you've actually done an interesting research on factors that influence a person's search for a dental clinic. Was that right? I mean, something about social media. Tell us a little bit about that.
Yeah, so it was our like final year research project as part of our like honors degree, and I think we picked that one because I don't remember why we picked it, but it was basically, I think it started when I was saying how the dental clinic I go to has a TV on the roof, but the ones in uni don't have a TV on the roof, but they have a massage chair function. And then I was saying, and then have patients would come in, they'd be like, oh, the chair's moving, this is great, kind of thing. And then I think that's kind of what started it. But we basically went onto the streets, or we brainstormed a whole heap of like factors that would potentially affect someone's choice of a dental clinic. And we went onto the streets, and then we had to ask people if they had 2 minutes to fill in this survey for a poor uni student. Obviously we got rejected a lot, and we learned that we never wanted to do that again, but we didn't have a choice at the time. And I think the summary of results was that TV doesn't really matter, massage chair doesn't really matter, to be honest. It's more so convenience for most people, and like positive reviews, like referrals from like friends and family and people in someone's immediate circle. So those are the two main factors that affected someone's choice of a dental clinic. So like your point was like that social media is really limited for more of the younger viewers, and word of mouth is really what's going to drive. Sure. And you were talking about, was it convenience of the attendance and maybe a booking appointments and maybe the cost, those kind of factors to play more of an important factor than what might be a social media platform account. like social media can get like some people in the door, but then like ultimately, if it's so hard to find parking and you're so far away, most people would be like, no, I'll just find somewhere closer by. Yeah. Yeah.
So, we've got a few guest questions for you. And I'm going to pronounce some of these guests wrong, but I'm going to give it a go. So, we've got D. Learn wanted to ask you, what is your general mindset when you take on difficult procedures or cases?
So Dylan's my partner, my boyfriend. And okay, my general mindset, did you say? Sorry.
Yeah, he wanted to know, what's your general mindset when you take on difficult procedures or cases?
Okay. Of course he'd ask me this. So I guess I've always tried to approach challenges in life with like a growth mindset, because I understand that challenges help me grow and the end will always justify the means. Slightly unrelated tangent, but during school, I used to be a runner on the cross country and athletics teams. And I remember one of my coaches told me, if it doesn't challenge you, it doesn't change you. And that's something I've tried to like hold on to through years, to help me through years of like tough training sessions. Because, if I only do things within my comfort zone, then nothing will change and I won't improve. So I guess going back to dentistry, this would also apply with taking on like new procedures or gradually more complex cases. I'm not afraid of a challenge, but I guess in dentistry, I would pick my challenges more carefully and try to have go in with the attitude of I won't know if I don't try. I'm really lucky to work with so many kind and helpful senior dentists who can talk through cases and procedures with me so that I can actually determine for myself whether it is something that I can attempt or take on for growth purposes or something that I really should just refer to them or refer away to a specialist. If I do refer to them, then I can block myself off and go and observe them and see how they tackle it and then learn in that way by observing and gradually pick up on things that they do and I make note of it so that next time if I do it, I try to do aspects of things that I see that they do which work. I guess making mistakes is something that no one really likes to do, but I've learned that failure is still an opportunity to grow. Like I can only do my best, and if something doesn't go to plan, then it will be a lesson for the future. If something doesn't go to plan, I will do some self-reflection and speak to senior dentists regarding what I could have done differently to achieve a better result the next time I do it, and bear it in mind, and then hopefully not make the same mistake again. But as I said before, communication is literally communication between the dentist and the patient is like the most important thing. And I feel like as long as they are aware of the possible risks and complications, then if something doesn't go to plan, then most patients are really understanding. Yeah.
Lynch, I think Liz, wanted to ask, what aspect of dentistry have you grown the most since graduation? Why and how?
What aspect of dentistry have I grown the most? Like in which field? Since graduation, I think I would actually say wisdom teeth, like oral surgery. At the start, when I first started, I had to ask for help a lot if I got into a difficult extraction and I just didn't know what to do. Like I didn't know where to remove the bone, or I didn't know the right way to section it. And I had to ask senior dentists to come and step in and help, bail me out of a procedure. But then over time, I've become a lot more confident in my extraction abilities. And sometimes, if a tooth is taking a long time to take out, instead of just giving up and going to taking the easy way out, I suppose, and grabbing one of the senior dentists, I would back myself more and be no, I've done this before, it's just some teeth just take time. And then I would just try and be more patient and give myself that extra time to take it out instead of panicking. I think over time I've built more confidence in my own skills to know that I'll get there kind of thing, instead of just giving up. So I think, you know, in terms of like extractions and that side of things, that's probably where I've grown the most. Yeah.
Yeah. Miss Angela wants to know, how has training new graduates developed your own skills?
Oh, okay. She always asks me hard questions. I guess, as I said before, by going to the CPDs that they need to attend and helping to coordinate them, sitting in there and, you know, listening to things the second time around, actually, to my surprise, has really, really helped me consolidate a lot of my own skills in that way. I actually don't work with a lot of the grads. Like, we just don't have like the same working days. I think I work like 1 or 2 days with them, but like they're like half days here and there kind of thing. So I don't see them that much, but sometimes when they do like cases and stuff, they would come and show me, which gets me really excited because you know, it reminds you of was back when I started, and I don't know, it consolidates how far I've come personally as well, even though I still have like a lot of learning to do myself. Yeah.
A few people have also asked, how do you balance your work and your personal life?
Oh, as in with my food blog and work. I think because they're so different, it really, really helps. And it's like, I don't get like a burnout per se, because it's just so completely different. They are similar in the way that they're both very hands-on. Like, if I have to create a recipe and take photos, I have to like plate it myself. It's very artistic, but that's also like the side of dentistry I enjoy as well, in terms of like the composites and stuff. So we can draw parallels in that terms, but everything else about it is so different. It's quite easy to balance, I guess, being a dentist, because I only work 4 days a week. So I get like 3 days off where I can do that stuff. And then sometimes, like in between a patient, if they're running late or if I have a gap, then it's quite easy for me to just hop on my phone and, you know, reply to some comments here and there, or I can like finish editing a photo during lunch or something like that, just turn off my brain a bit. I guess it's because I enjoy doing food blogging so much. It's like my like release. So I think that helps me in that way. Yeah.
Yeah, I guess dentistry is not all about, I mean, life shouldn't be all about just dentistry. You just gotta branch out and find some of those hobbies. So Dr. Michelle Chen, thank you for coming on the show today. If you could let the people know how they can find you or what's kind of going on in your life.
How to find me? What's going on in my life? Well, actually, I just bought a house. So next month will be moving month. And I'm still staying in the same area in Southeast Queensland, so you can find me over here. And so if anyone's around, you can message me, and if you want to hang out, I'm always keen to hang out and meet new people. So yeah, thanks for having me.
House parties, hey, at your place.
Yeah.
So, for all of our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe. For our listeners, if you like this episode, leave a review as well, but don't forget to share it with your friends, and we'll see you on the next episode of CPD Junkie Podcast.
Cool. Thanks for having me, Lawrence. Bye.